It is now. We're good. All right. So let's get started. All right. So this is the well-being of the EMT. I will tell you, in the last textbook, this was actually 2 different chapters. So they put this together, so it's got a lot of information. We've combined kind of the bloodborne pathogens, some of the scene assessment stuff together. Before scene assessment used to be separate from this, so it's kind of a lot. So we'll work through this. Like I said, this has got some really good information. This has got some new information, and it's got some discussion stuff. So here's the complaints I've had in the past, is we get through this chapter and students are like, man, you seem paranoid. That's not my intention, right? I don't mean to come across paranoid. I don't mean to come across like this is the most dangerous job in the world. I'm not trying to discredit anybody that does dangerous jobs or say that we're more dangerous than others. But this is turning into a pretty big trend, okay? 2 of the things that came out this year, one of them was FEMA came out and recommended that every single firefighter in this country buy a bulletproof vest and wear it on every single call, right? And that was mind-blowing. All of us were like, time out, did you say Kevlar? Like, that seems a little crazy. That's kind of the world we're living in. There are some places where this stuff happens more often than others. Spokane, knock on wood, is fairly lucky, right? I know of a couple people at AMR that wear Kevlar. I have a bulletproof vest, but I don't choose to wear it on every single call. I know of some fire guys that wear bulletproof vests. It just depends on where you work, your preference, your comfort level, or whatever. The other one we're going to talk about, assault on healthcare workers. There's a program here in the United States called Defense Tactics for EMS, and he's I wouldn't say a friend, but an acquaintance of mine. So I emailed him today and said, hey, give me an updated percentage so I can use it to teach tonight. And he said NAEMT, National Association of EMTs, is saying 80% of EMS will be assaulted at some point in their career, right? They define assault as anything that is spitting in your face, that's assault, right? All the way to hitting, punching, kicking, biting, stabbing, shooting, that kind of stuff, right? So it ranges from a lot. So we're going to talk about some ways to prevent that. In a couple of weeks, we're going to bring in Jay from Spokane Police Department. He's going to talk about a couple more things when it comes to assessment and protection. So here's one question we're going to use to discuss this a little bit, right? If you don't want to participate, you don't have to. So someone tell me, we're going to ask a couple of you to answer if you don't mind, the type of call that I believe will have the most severe emotional impact on me is blank. So what do you think? Most severe emotional impact. Go ahead. Okay, so someone that you know. What else? Go ahead. Okay, so small children and death. Kids. Okay, what else? Anything else different from that? Say that again. Abuse, throw neglect in with that, right? Abuse and neglect are going to go hand in hand. What else? Anybody else? No one wants to go like severe blood, guts, gore, nothing like that? All right, I thought I'd ask. You never know. All right, so what about the call? So a type of call that I believe will have the most positive emotional impact on me. What do you think? This is kind of the negative side, right? This is more the positive side. What do you think will get, a call that would be a positive impact on you?
One where you get a thank you.
So one where you get a thank you. And at the end of this class, we're going to teach a PowerPoint called People Care. And it's a book that me and Gary turned into a PowerPoint. And we're going to talk about weighing the TYs and the FYs. I will tell you, TY stands for thank you. You can fill in what FY stands for. Okay, so when you get a thank you, what else? Saving a life. I like that. What else?
How about doing CPR on somebody and then still dying?
That'll have a positive impact?
if you're not going to go into EMS with the most twisted, warped mind in the world, you don't need to be in it. But my most positive emotional impact that I've ever had is I did a CPR, or we had a CPR full arrest up in Springdale on a 70-something-year-old man. That was the most positive, even though he died. And the reason why is because we literally took everything out of our toolbox to try to save this man's life. And at the end, you can see the thing, she never said it, but the wife had I appreciate you guys all over.
It's a good thing you described that, because I was going to refer you to a psychiatrist, but now that you explained it, we're good. All right, the different one. Anybody else? Nothing else? All right. So the thing most likely to kill an on-duty EMT is what? What do you think? So there's number one, right? Plane crash. Off-duty EMT, or on-duty EMT, a plane crash? My goodness. How about ambulance crash? I'm going to go with that one, right? These three are statistically more likely to happen than you being assaulted, right? We're still seeing people who are showing up on car accident scenes, stepping out of an ambulance and getting whacked by a car, right? They're not wearing reflective vests. We're not controlling the scene properly, whatever the case might be. Heart attacks is still really, really common, right? If you looked at the news lately, I don't know where it was at, there was a paramedic who went on the call that involved his daughter. Where was it at? New Jersey. Yeah, daughter was non-lethally injured, but then he had a massive MI and ended up dying, right? Pretty sad and pretty scary. But MIs, heart attacks, is still really, really common when it comes to things that will most likely kill an EMT. What about the most likely to injure me so I can't be an EMT anymore? Number one is back injuries, right? So keep this stuff in mind. This is the stuff you got to kind of prepare yourself for, right? You're going to have that list of things that you know will bother you, and we're going to talk about how to deal with that today. This is the stuff that you put in your pocket and you utilize to your advantage when you can, right? It's the things maybe you recall once in a while to remind yourself why you do this job. And I will tell you, I've had one CPR save in my career, one of the best moments of my life, right? In my EMS career, by far, I got a chance to shake his hand, go see him in the hospital, have him thank me, his wife thank me. The most amazing experience in my EMS career. If I get upset with my EMS career, that's my go-to, right? Patients do a really good job. They like the care that you gave them or whatever. They send a thank you card or a letter or something to your agency and thank you. Take a copy of that stuff and keep a folder of it, right? Because as you start having a hard time or figuring out whether or not you want to do that job, recall on some of that stuff and utilize that as that positive reinforcement. Because trust me, there's a lot more F-Ys than there is T-Ys in this job, and I guarantee you, right? So you got to remember those T-Ys. It's really important. So well-being, obviously, keeping yourself prepared for demands and risks of your job is extremely important. Whether that means being physically fit, being emotionally fit, being mentally fit, maybe you work in a system that requires, maybe you should go buy a bulletproof vest and you should wear it on every single call, right? When I got a bulletproof vest, I was like, I don't want to wear it every single call. It's hot in the summertime. So maybe I'll only wear it on calls where there's a chance of being shot or stabbed, right? The calls you get shot or stabbed on are not the ones that you thought you were going to get shot or stabbed on, right? They don't call you and say, I want to kill an EMT, and you walk in the front door, right? Because that's dumb. You walk in the front door for a chest pain, for a shortness of breath, or for something else, and you're put in a position where something along those lines happens, right? If for any reason you are unable to function, they're not going to get the care they need, right? You have a bad call, maybe going on the next call may not be the best thing for you, nor is it the best thing for your patient. If you can't have a clear mind, take yourself off the rig, take yourself off the shift, whatever the case might be. One of the things I will not have a problem with when you do your internships, let's say you get a bad call, right? Something that bothers you, please let your paramedic preceptor know. They will drop you back off at AMR, and I want to be one of your first phone calls, right? I'm not going to counsel you unless that's what you want, right? Just be like, hey, I had a bad call. I got to go home. And I'll say, perfect. Let me know if you need something, and you're done, right? Don't try to stick it out and just see the rest of the day, because some of the times that builds on itself and causes some bigger issues. Whoops. So maintaining your well-being, exercise, sleep, eating right. Notice how it says limiting alcohol and caffeine. It doesn't say don't take it, right? Seek a physician regularly and keep up on your vaccinations. One of the best ways to protect yourself is that preemptive vaccinations, right? Protect yourself with shots to keep you from getting something from somebody else. We're going to talk about sleep here in a second. This by far is probably one of the biggest things that we encounter and hear people say, well, you can't eat right in EMS. That's garbage, right? It's a good excuse. We've used that crutch for a long, long time, but it's garbage, right? You can prep food and take it with you. I mean, I wouldn't recommend you keeping your food in the patient compartment, but you can keep it in the front seat, and try and do the very best you can to eat right. exercise. Fire departments tend to be a little better with exercise equipment provided than the EMS services. Sometimes EMS places have gyms, sometimes they don't. It just kind of depends on, the circumstances. We're going to talk about personal relationships here in a second and how important that is. So this is the one, last class kind of got the first dose of this, of people saying that lack of sleep is part of EMS, right? When I got into EMS, they're like, if you can't go 36 hours without sleeping, then you're never going to make it in this job. First off, 36 hours without sleep is dangerous and it's unhealthy, right? We're talking about the length of time, 24 hours. If you go 24 hours with no sleep, that is equivalent to that much blood alcohol, right? That's over the legal limit to operate a motor vehicle. So you're going to go 24 hours with no sleep, you're going to get into an ambulance, and you're going to drive code 10 over the posted speed limit on the wrong side of a highway, and that's how you're going to operate, right? It's dangerous. They did a bunch of statistics and pulled 1.9 times more likely to be injured. You'll do something stupid, right? You'll lift improperly, you'll carry something improperly because you're tired. 2.2 times more likely to commit medical error. There was a case in Portland of a nurse who'd been up for 12, 24 hours, however long it was, gave the wrong medication to a patient that killed the patient, right? That is a lawsuit that you don't even want to encounter, right? Probably lots and lots of money involved with that. 3.6 times more likely to be involved in safety compromising behavior. This is that stepping out of your ambulance before you check for traffic. That's walking into houses that have lots of red flags that you shouldn't have been in, right? Sleep deprivation is not a good thing. There is now studies that show sleep deprivation has a direct correlation with your chances of getting PTSD, right? In the military, they are proving the people that are coming out of PTSD were suffering from sleep deprivation when the incident occurred or right after the incident. They get involved in a bad battle, they come back, and instead of going to bed, they engage with, drinking or video games or, goofing off, whatever, or they get stuck going back out on patrol or back out on some sort of incident, and sleep deprivation has a direct link to that PTSD component. So that's what we're trying to look at. Deer Park Ambulance, when I started there, we had no cap on how many shifts you can work, right? So you could just work as many shifts as you want in a row. Now we say if you've gone 24 hours, you've got to take 12 off, right? We don't want people working 36 and 48s and 72s, and from that point, I can't even count that high. It's dumb, right? We want you to go home and get some sleep. So what are some other things besides sleep do you think that will prevent or treat when you have a stressful day or a stressful circumstance? What are you going to do? How are you going to fix it? Talk to people. Exercise. Exercise. What else? I thought it was going to come from Brandon. No lifting, no go to Oz Fitness. You weren't going to plug your Move Fitness, spew into this or what? Netflix. Nice, good call. That's messed up. That's messed up. What else? It's going to be a long class. 3.5 months of you two. What else? We got exercise. What else? What else do you guys do to relieve stress? Don't answer that? Okay. Any of you drink alcohol to relieve stress? Nobody's going to admit to that? Good call. Thank you for being honest. What about drugs? Good call. Leave your hands down. Right? What about shooting guns? See? You guys are a bunch of liars. When I ask you a question, answer it honestly, right? Is that a bad thing? Absolutely not. Right? What else do you do to relieve stress? What's that?
Oh, roller derby.
Roller derby. There you go. Beat other people in a fake sport. No, I'm just kidding. That's going to be a long clap. I'm just kidding. What else? Riding motorcycles. What else? See, I'm actually building relationships, right? People are like, oh yeah, you ride motorcycles? I'm making friendships happen. What else do you relieve stress? Someone else hasn't talked yet. No one from the front row wants to talk? The quiet row in the front? I don't know how that works. Yeah, usually. So, I get to brag just a little bit, right? You'll see lots of pictures of my little daughter, right? So, you have to have a support system. If you have no support in your life whatsoever, your career is going to end horribly, right? So, you have to have a support system. I'm lucky enough to have the person I'm married to be an EMS, right? I have a bad day, I get to come home, and we can have that conversation. You don't have to have a partner in EMS. You could have a husband or wife that's not involved in EMS. It just depends. There's no correlation of, date people in EMS, you're better off or not, right? But the person you have to have, there are days in that relationship where you come home and they say, how's your day, and you don't want to talk about it. If they're non-EMS folks, they have to be able to either A, leave you alone, or B, re-engage you at a different time, right? So one thing we keep hearing from people who are in non-EMS relationships is the fact that when they come home and their spouse says, how's your day, and you say, I don't want to talk about it, that spouse just pokes and pokes and pokes and pokes and pokes and pokes until it causes a problem, right? So whatever relationship you have or whatever support system, make sure they understand there's a time and a place to ask and there's a time and a place to leave it alone, right? One of the things that I've dealt with all my career and every other person deals with in their career is the one question that a non-EMS person asks you when they find out you're an EMT. What's the question? What's the worst call you've ever been on? Right? And there's two types of people. One, what they don't realize is, and it's kind of cliche, but we're starting to tell people, you are having us recall our worst day. Right? So you might tell them, and they go, oh my God, I didn't want to hear that. And it's like, you asked. Right? Or you have a choice. You can turn it around and you can use that positive emotional call and say, the worst call was someone who was in cardiac arrest, but the positive outcome was the fact that you could tell that wife was very thankful for what we did. Right? So you got to be prepared for that stuff. If you don't know that question's coming, it catches you off guard. Right? You got to know it's there. All right, so here's personal protection on the equipment side, and we're going to talk about a couple of things down the road. So there's a couple of terms you're going to get used to. BSI is one of them. BSI stands for Body Substance Isolation, right? Some of you will call it PSI. I don't care what three letters you use, as long as I know that you're talking about personal protective equipment, right? Standard Precautions, okay, is the idea. BSI is what you choose to wear, right? And BSI changes with different calls. If it's you're just wrapping an ankle that's been sprained, you're probably not going to choose to wear gloves and goggles and mask and a gown and booties and a hoodie, right? Now, if they're spewing blood everywhere, maybe you choose to wear all of those. Does that make sense? So BSI, or standard precautions, this happens before your scene assessment even starts, right? This is number one. If you peeked ahead to your skill sheets on both medical and trauma assessment, BSI is number one, right? And in all of your stations, if you do not either A, verbally say, I'm wearing gloves, or B, actually put gloves on, you critically fail every single station, right? You got to wear gloves. Pretty self-explanatory. So one of the things that Washington State came out with was requiring us to wear safety glasses, right? And when they came out, we were like, we don't need to wear safety glasses. This is stupid. I will tell you, I wear my safety glasses 100% of the time perfectly on the brim of my hat, right? That's where they almost always are. You walk in the house and you leave and you're like, oh yeah, I was supposed to put these on, right? There are those circumstances where stuff will get in your eyes, right? Coughing, hacking, spewing, sneezing, whatever. If it ends up in your eyes, it's in your bloodstream, right? You wouldn't have an open cut and go ahead and touch a patient, would you? Then why leave an open, basically, orifice for diseases or blood to get into your body, right? Wear glasses. Here in this class, if you are in the airway position or the airway role, I'm going to ask that you wear safety glasses. Even on our mannequins that don't actually, bleed on you, you're still going to get the habit of wearing safety glasses. Make sense? So all this safety precaution stuff is because of OSHA. You can blame them, right? And this is pretty much everywhere that you work usually has OSHA guidelines, okay? This is the biggest thing. If you doubt that you need it, then just put it on, right? If you're like, should I wear a mask or not wear a mask? Put a mask on, okay? Should I wear goggles, not wear goggles? Put a goggles on. What's the one personal protective equipment that you'll probably always wear? Gloves, right? And now in Washington State, goggles or glasses, right? But gloves no less at all times. Here is a picture of all the possibilities. Okay? Why should we change gloves in between patient contacts? Cross-contamination. Okay? Any other reason? I was just asked just in case there is one I didn't think of. I'm good. So, how many of you have ever worn gloves before in your life? A couple of you. I mean all 26 of you. How many of you have taken a glove off and immediately try to put another glove back on your sweaty hand? How much fun is that? Not. It's like Ace Ventura coming out of a rhinoceros. Right? If you've seen the movie, you know what I'm talking about. Okay? So, how do you avoid that? Especially in the circumstance that you only have 3 seconds between patient contacts. How do you avoid having to put that nasty glove, or a clean glove, back on your nasty hand? What do you think? What? Yeah. Put 2 pairs of gloves on before you get out of the ambulance. Right? So you can just pull a glove and have clean hands. If you know it's an MCI or a car wreck that's got 2, 3, 4 patients, please don't put like 4 or 5 pairs of gloves on, right? Because then it's like 3 smalls and 2 mediums and then a large and then an extra large on top of that. But 2 or 3 pairs of gloves will do you just fine. That way you can peel a glove and still have a clean hand if you're swapping from person to person. That's how you take gloves off. Number 1 best way to prevent contamination is wash your hands, right? You can use alcohol-based hand cleaners as long as your hands are not visibly contaminated, right? So take your gloves off, hand sanitizer. That is the only thing I'm obsessive compulsive about is hand sanitizer, right? I go through it like you wouldn't believe. If I see it, I use it. Thank God they moved the dispenser from this side of the room because every 10 seconds I was taking hand sanitizer, right? Now it's over there and I can't reach it from here. Okay? A lot of us carry a small one in our pocket, put it in your ambulance or whatever. It's a good thing to have, a good habit to get into. That's how you wash your hands. That's how you use hand sanitizer. So eye and face protection prevents splashing, spattering, spraying fluids from entering the body. Anybody that has the risk of splashing, spattering, or spraying on you, you need to wear face protection. Okay? I'm going to go back for just 1 second and tell you that this is the most common form. Okay? A good combination between a face mask and a shield. Okay? It needs to provide guard from the front and both sides. Okay? Your safety glasses need to be OSHA approved. Okay? If you want to buy your own, great. I encourage you to buy your own. Because usually the ones that are with your agencies are the ones that fog the second they touch your face. Go spend the extra money, have your own pair, that way they're anti-fog or they're comfortable for you or whatever the case may be. Those things are ridiculous looking. So, masks in general, cases where there's blood or fluid splattered, surgical mask. If they have an airborne disease that's known, you need to wear what's called an N95 or a HEPA mask. Okay? These masks, when you get hired on with an agency, they'll do a fit test to see if it seals on your face like it's supposed to. Right? That way you know what size you are because it's not, I'm going to go back, sorry. It's not one of these masks, right? It's something along these lines, and they have a size that fits your face. Okay? It needs to have something that seals so that you can't get anything in the size. Okay? So TB, anything respiratory-borne you'd be concerned about, obviously N95s. They're coughing and hacking with like flu-like symptoms. You can just put one of those coffee filter ones in their face, or you can put a coffee filter one on your face, something along those lines. We're getting a little bit better. EMS were really bad about it. They were coughing to actually cover their mouth. You get to the ER and they want you to cover it, but in the ambulance we were really, really bad about doing so. We're trying to get a little bit better. Anytime that you are suctioning, right, or dealing in the airway position, you need to have face and eye protection. Okay? Pretty darn good chance of that person coughing or spewing or whatever, and you do not want to taste what they had for lunch, breakfast, or dinner. Right? People puking in your mouth is disgusting. Okay? I don't do well with puke at all. But they puke in your face, not a good thing. Right? Makes you want to throw up. Just thinking about it, I'm getting like that feeling. So gowns, may also wear a gown to protect clothing and bare skin. This is usually like your contact precautions. TB is the only time ever in my career that I've ever gowned up. Right? I transported one TB patient and we gowned up, so, mask, goggles, gown, the whole thing. But other than that, that's about the only time, when we were all scared about Ebola coming to Spokane, Washington, we had the conversation about gowning up and all that stuff. But it's got to be a pretty aggressive or pretty well-known airborne, contact-borne, something along those lines that you'd be wearing a gown. The only other time would be when delivering babies, you're probably going to have a gown, right? Because you're trying to keep as sterile as possible. And there's a lot of chance of spraying, splashing fluids. So we'll talk about that later. Don't eat before the OB chapter when you come to class. I strongly discourage that, trust me. Yeah, don't have food, just starve yourself for 24 hours before. So disease of concern, we're going to talk about Hep B and Hep C, right? Hopefully, all of you are going to get Hep B vaccinations, right? Because if not, you can't do your internship, therefore you can't pass this class. So I encourage you to get your Hep B vaccination. No vaccination for Hep C yet, but it poses the same risk as Hep B. This is kind of the scary one because it can live on surfaces and dried blood for up to several days, right? This is the poor cleaning practices after patient contacts. I will tell you that a lot of people are really good about wiping down their the stretchers, wiping down their straps, wiping down their blood pressure cuffs, wiping down their stethoscopes. Thank you, Caleb. Wiping down, countertops, stuff like that. The things that you never see people wipe down are their cell phones they were using with their gloves on, right? I've had partners who never wipe down their pens, and they get done with the call, and they're writing with their pen with their bare hands, or they stick that pen in their mouth to hang on to it. And they were using it with their gloves, right? It's the little things you don't think about that you end up getting exposed to something because you're not paying attention. If it was in your hands with gloves, either throw it away, not if it's your cell phone, wipe it down, right? Make sure that you're not getting yourself contaminated. TB is an infection of the lungs, right? It's highly contagious. The scary one is the airborne side, right? So the second you walk into a house in close proximity to that patient, you're talking about being exposed. So make sure you're, a lot of the one TB case I had, we were met at the front door by a family member who was like, they have TB. So we weren't even in the house, no big deal. We gowned up, masked up, whole 9 yards, pretty well covered. So you flash back like 15, 20 years, this was the big scary one in EMS, right? Was, oh my gosh, you didn't want to get HIV. If you get stuck with a dirty needle with a person positive for HIV, 0.01% chance you will contract the disease, right? That's tiny. You get stuck with a dirty needle for someone with like Hep B or Hep C, 10% chance you're going to get it, right? We're more concerned about hepatitis than we are about HIV and AIDS. I've had patients that are, HIV positive that I go start an IV on, and they say, hey, you probably don't want to start an IV, I'm HIV positive. And you go, okay, I'm wearing gloves. And you just start the IV anyways. It doesn't really matter, right? It's not that scary. It's not that big a deal. Know it, right? Know precautions. Wear gloves. You have to wear goggles because it's the state of Washington if you're operating here. Other than that, there's no need to gown up or anything along those lines. So Ebola, we had to talk about this, right? So Ebola, people in the U.S. infected in 2014, and everyone freaked out, right? We had conversations. We had places that were asking, if you were called to a person with Ebola in their house, would you transport them? We had EMS providers who were saying, look, I'm not putting myself at risk. I would not transport you because you had Ebola. Guess what? You can't do that, right? That is not part of your job description. Okay? With this big conversation, we had all these ideas of, how to disinfect your ambulance and how to, contain it, all this stuff. And then here we are, a year and a half later, and we're pretty much not even talking about it. I sat through this wonderfully intriguing 4.5-hour long presentation by the CDC on Ebola, and they said the one thing the Ebola scare gave us is to prep for whatever comes next, right? They're not that concerned about Ebola, but they're using that to prepare EMS and healthcare of what if something else would to come with this kind of severity, right? SARS spread through respiratory droplets, Middle Eastern respiratory syndrome. Again, these are pretty unique. I've never had any history with them whatsoever. So you would have to ask questions, or patients would have to tell you. Anything that's respiratory, I would encourage you to wear goggles and gown and a face mask, right? Just assume it's going to be airborne, and you're going to want to protect yourself. Avian flu, bird flu, swine flu, it's always scary every single year. Get your flu shot. Don't get your flu shot. I don't care. The nice thing is you guys are the winter EMT class, so therefore you're out of flu season by the time you guys do internships, so we don't require a flu shot. If you want to get one, great. If you don't. No big deal. Yeah, we do it for all the classes, but you don't have to have it. Did you get the flu?
I'm sick right now.
Nice. I love the flu shot.
So let's try to get a free.
All right, so infection control in the law. So us as EMS personnel and healthcare workers, we're at a pretty high risk for coming in contact with diseases, right? You're taking care of sick people. That shouldn't be a shock to you. So you really have to learn and know those OSHA laws. Really, you know, when you go with an agency, they'll give you a bloodborne pathogen course. You get one out of this class that we're giving to you right now. A lot of the agencies provide training, you know, protective equipment. If it's required that you have it for PPE, they have to provide it to you, right? You don't have to go buy your own N95, right? You don't have to go buy your own safety glasses. You can choose to buy your own safety glasses, but you don't have to. I encourage you participate in infection exposure control plans. That way you know what it is. Your exposure control plan is the policies your agency have in effect if you would to get exposed, right? You go on a call and you get a dirty needle stick for whatever reason. Know what is going to happen after that. Does that make sense? So know what's considered to be an exposure. Some people freak out about stuff that's not really considered an exposure, right? If you get blood on your uniform, is that an exposure? It's not, right? Because as long as it doesn't come in contact with your skin, it's not considered to be an exposure. The way I think about that is most exposure control plans, A, are known by your supervisor, right? B, you have to go to the hospital and get tested and treated, and that's at like day 1 and then day 7 and day 30 and like 9 months later. So think about it. If an exposure was getting blood on your uniform, every single time you get blood on your uniform, you have to call your supervisor, go to a hospital, and then get tested 4 times in the next year, right? That only happens if you have blood come in contact with an open wound or your skin or something along those lines. The exposure control plan of the bloodborne pathogen stuff, they'll talk about how to clean stuff, what has to be cleaned with bleach solution, what can get cleaned with just the disinfected wipes. Is there any airing out procedure? Is there any post-exposure evaluation? How to label stuff? All that stuff is all covered when you take the occupational exposure stuff. How many of you read about Ryan White CARE Act in your textbook? So tell me about it. Okay, so there's that side. That's where we get the name. But tell me how it applies to us as EMS.
Well, in 1990, when he died, I don't remember exact year, but Congress enacted the Ryan White CARE Act, which at that point, all EMS providers we had the right to know if that patient was exposed to any bloodborne pathogen that we could contract.
Okay.
And then in 2009, they extended that act in Congress.
Okay. Frank, you got something to add?
I was just going to say the fact that it was airborne, they have to tell us, but otherwise we can request that they are not going to tell us unless.
Right. So yeah, this has 2 sides, right? There's the airborne side and there's the bloodborne side. The airborne side, we don't know we're exposed, right? Because if they don't know, we don't know. So what happened is if I transport a patient to Holy Family, and let's say at Holy Family they found out the patient has TB, that someone at the hospital would call our exposure person, which is just our supervisor, and say the people who transported a patient to Holy Family have been exposed to TB. That person would notify us, and we'd go get checked, right? That's the airborne side. The bloodborne side is if I get a dirty needle stick, someone bites me, someone spits blood in my face, something like that, we get to the hospital, I report it as an exposure. If they find something during their normal realm of testing, they will notify us that we've been exposed to something. Does that make sense? So there's the airborne side and there's the bloodborne side. I will tell you that this is a huge protection over EMS and healthcare, right? We are because there was a question in 2009 whether or not they were going to reinstate it or continue it. We're very, very glad that they did. This is a huge protection for us. Talk about that. Tuberculosis compliance mandate. This is that respirators with N95. Having to wear those N95s if the patient is suspected to have TB. Get fit tested when you get out of an agency. That's the best we can pretty much say about this stuff. Once they're there, right, once you get into the hospital, make sure you notify the hospital ahead of time that they are respiratory isolation. Leave the back doors of your ambulance open so it can air out, and then wearing personal protective equipment, you have to decon your entire ambulance, everything, right? Bumper to bumper. Wipe everything down, air everything out. During transport, they recommend using an exhaust fan that pulls the air out of the ambulance to decrease the chance of you being exposed. Wipe everything down. This is a pretty long process. So a lot of times we're out of service or not able to respond to calls for a period of time after these. Really the biggest, especially with TB, the biggest time that you're going to have the high risk of contracting something like this is anytime you're doing endotracheal suctioning, so suctioning a tube that's in their mouth, or any sort of intubation. You guys do get one form of blind insertion intubation that we'll talk about later, but doing any sort of aggressive airway control, that's going to be the high chance you're going to have because you're right in front of their face. The chances of them coughing or sneezing or hacking into your face is pretty common, so making sure you're wearing that N95, wearing those goggles is really important. Immunizations, we've pretty much already talked about. TB test every year, Hep B, making sure that you're vaccinated, MMR and Tdap and all that stuff. Depending on your local system, I know like here in Spokane County, you can opt out of the TB test once you're with an agency. If you decide you don't want to have a TB test, you send a form and say I don't want it. But it's one of those things we recommend that you keep up on. All right, so here's the not fun stuff. Not that that was fun, but this is even less fun. So this is kind of silly, right? It seems a little touchy-feely, hold hands and hug kind of thing, but I think it's got a good point, right? So it says, don't give up. We have all come home in tears. We've all second-guessed what we've done, or we do what we do. We've all felt like failures at times. We've all wanted to quit at some point. Just remember, you save lives. You comfort the sick. You can't expect that to be easy, right? If someone in EMS tells you they've never been at one point on one of these, they're a liar, right? I had lots of calls where you're like, yep, we failed, right? Lots of calls where you're like, I wish we could have done something more, right? Select calls, we'll talk about tiers here in a minute. There's lots and lots of calls that you'll second guess what you do, right? There's a lot of downtime in EMS, okay? So after a bad call like that, in most systems, you have a chance to kind of think through it, and that's where that second guessing, that's where those ideas of did we do the very best we can start popping up in your head. So if you don't like stress, or if you don't handle stress well, you probably should figure it out. I'm not saying don't be an EMS, but I'm telling you to find ways to relieve stress, to deal with stress, because guess what? You can't change it. And this could be positive stress, this could be negative stress, it could just be adrenaline, it changes all the time. The other big thing, we're more going to talk about ourselves in this PowerPoint, and then about halfway through the class, we're going to talk about how to deal with people when we're dealing with suicide, right? Patients that are calling because of suicide, that's later on down the road. Today is about how do we take care of each other and ourselves, not about our patients yet, right? Because we're still number one priority. So the aspects, the way your body reacts to stress, you got 3 stages, right? Stage 1 is the one we've probably all been in, right? How many of you ever had an adrenaline rush? I guarantee you, if you've ever been scared, ever like someone tried to scare you, ever once been in a car wreck, whatever, right? Everyone pretty much has been in the first stage, right? This is the increased heart rate, increased respiratory rate, dilated pupils, increased blood pressure, and you get that jittery feeling, right? This is that fight or flight, okay? If you've had first stage, you've had the second stage, right? Which is that drop. This is where you get tired after something, right? Your metabolism kicks up, you burn through your glucose storages, you burn through your cortisol, you burn through oxygen a little bit quicker, so your heart rate decreases, your respiratory rate decreases, your blood pressure drops, your pupils constrict, and you kind of have this like coping or relaxing phase, right? This is normal, okay? This third stage is the exhaustion phase, okay? This is the stuff that we have to recognize, okay? This is prolonged stress or multiple stressors that build on each other. This is where you start actually having organs that can fail or organs that have damage, long-term effects, psychological effects. This right here needs to be dealt with by a medical professional, right? This is normal for us. First and second stage happens on a fairly regular basis, right? As long as you cope with it, deal with it like you're supposed to, we try to eliminate the possibility of that third stage. So there's a couple different types of stress reactions. Acute stress reaction is the one that we most commonly talk about with EMS, right? This is some sort of catastrophe, right, or a big event or a high stress call. This is where EMTs and paramedics operate, right? You also have to remember that your patients, in most circumstances, have the same adrenaline dump that you do, right? You're both walking in, you're walking in, they've already been there, with the same adrenaline rush, right? So you have to think about that. When you walk in the door, these patients may have been that high heart rate, high respiratory, high blood pressure for the last 5 or 10 minutes, okay? You're just now walking into that circumstance, so pay attention, right? Because one of the safety considerations we're going to talk about is patients or patients' family on scenes that are high stress. Normal reaction, right? It sometimes, depending on the circumstances, requires some sort of professional intervention, right? Just depending on how long you have this stress reaction, depending on the circumstances behind it, right? What they're linking is when you're doing this sleep deprived, that's where we have concerns about this turning into like a PTSD reaction, okay? So here's the delayed stress reaction, okay? So this is the PTSD side. So the downfall of PTSD is this doesn't happen the day after or the week after or the month after in some circumstances. Sometimes this pops up so far down the road that you can't even link it back to that event, right? And EMS, it's really easy because if I got 100 bad calls and in a year I just have emotional breakdown, they won't know what 100 of those calls caused me to have the problem. Does that make sense? So PTSD is a little bit hard. That's why you need to go seek mental health professionals because they will work through the process of trying to find out what was the trigger, right? I taught a refresher class and I was talking about PTSD and there was a kid from, I think it was Boise, that said that the college down there has a program for PTSD suffering vets where they take them out and they do the opposite. Normally you think about like PTSD and keeping them away from stress and putting them in a room and having them talk to a psychiatrist and all that stuff. This group gets together and takes them out and has them do high stress activities. Whitewater rafting, rock climbing, high altitude climbing, mountaineering, and they get their stress level high and then talk to them about how to cope with that stress. And it's kind of a really weird spin on things. And I said, well, how does it work? And he said, we're still pretty new, but we're seeing people that say this is much better than the hundreds of hours I've spent with a psychiatrist, right? You take that level and get them back up to that anxiety level and talk about how do you deal with it, work through it. Maybe they start reaccounting things in their head that they didn't realize they remembered and working through those, through that process. So cumulative stress reaction, this is like low levels, or many years of low-level stressors, right? Early signs, you're tired, you're exhausted, you might change your eating habits, your sleeping patterns might change. This is the one that we used to think EMS always fell in, right? We kind of always thought, well, it's the cumulative stress reaction, that's kind of where we're going to stay. We really didn't think about the PTSD side until just a couple of years ago. If this is left untreated, this progressed to physical complements, loss of emotional control, irritability, depression. This is that severe withdrawal. Suicidal thoughts is a possibility. So this is where you got to pick up on your partner or your family, right? This is where, let's say you work with a guy or a group of guys for 5, 6, 7, 10 months, more than a year, whatever, and someone starts changing their attitude, that's where you got to pick up on it, right? Don't be afraid to walk up and be like, hey, you doing okay? Or, hey, what can I do for you? What's wrong? Something along those lines might be the one trigger they need to talk to somebody, right? I've always said that there's a lot of wasted time in EMS, right? I feel like we do more things that are totally worthless and a waste of time than any other career in the world, right? And by that I mean those of you that work for a fire department, when you drive to a call, just District 10, on average, how much time from station to call, on average? 15 minutes. So then time from call back to station is 15 minutes on average? So there's 30 minutes per call. How many calls do you guys run in a year? 1,000. So 1,000 times 30 is what? 30,000. 30,000 minutes, right? How often are you talking about what happened on the call, or how you felt after the call, or how often are you talking about what movie you're going to see later, what's for dinner, who did you see on the call, where the call was? See what I'm talking about? There's all this time that in an ambulance, it's even more. There's probably 30 minutes to 45 minutes that I spend on the way to a call that I'm flipping through a radio station, that I'm trying to find out where the hell I'm going, right? Or I'm just like driving down the road. On the way to a call, what are some of the things that you can talk about with your partner before you even get there? What do you think?
What should you look for?
What should you look for, like how, Brandon?
Like, so if we know that when we get the call, we get told kind of what's happening.
Right.
And then we talk about what we expect it might be and what kind of questions we ask to figure out, like, kind of lead us to that situation.
Okay. So there's one. What else can you do? What else do you think?
Well, we do like a lot of assignments and stuff, you know, like especially on calls that are going to be like where seconds matter. I mean, if you go to like an alpha, you know, somebody's...
So alpha means nothing, right?
Yeah, not a big deal.
Okay.
I mean, you go to an echo call, you know, you'll have your assignment before you get out of the truck.
So you determine roles, right? Who's going to lead? Who's going to follow? Right now, when we talk about scene safety, I'm going to teach you who's going to contact and who's going to cover, right? Who's going to watch the door if you know this place has got a history of having some issues? On a cardiac arrest, who's going to do CPR first? Who's going to do it second? Who's going to do it third? Who's going to be in charge of airway? Who's going to be in charge of the AED? All that stuff can be predetermined, right? Now, on the way home from the call, what can you talk about? Other than, like, what movies, what are you having for dinner, what's on Netflix?
On the call, what went wrong, what we did well, what can we change.
Okay? So you can just debrief a little bit, right? The other big one is if it's a high-stress call or a call that you know, the list that you built in your head of a call that was going to bother me probably was a call that bothered somebody else. So maybe if it's four of you in a truck, then maybe you say, hey, everyone okay? And they say, yep. Maybe you as the leader, whoever's the lead in the call, checks in with each one of them, right? In private, hey, you doing good? Hey, you doing good? Hey, you doing good, right? One of the more intense calls that I've been on is we were dispatched to a house explosion, right? And we showed up down in Chatteroy, and it was a mobile home, double wide, where a husband had called his soon-to-be ex-wife to the house, and when she walked in the door, he had taken 6 propane tanks that he had opened and were leaking into the double wide, and she got in the back room and he lit a lighter, right? It blew up with enough force to throw her out the mobile home and into the next lot, right? She was burned 60% of her body. He was burned almost 100%, and they were both alive, right? So we worked this whole process, 2 helicopters, lots of agencies, fire department, whatever, and we got done. And, technical partner was like, hey, how you doing? They're like, well, that was kind of crazy. I said, I agree, right? So we had that conversation of what we do right, what we do wrong, what do you think, what do you see? And then a week and a half or so later, that person texted me and said, hey, how's it going? And it was like, I don't have your phone number in my phone. So I was like, who are you? Right? And they were like, this is so-and-so. And I was like, oh, hey, how's it going? And they were like, good. And I was like, how are you doing? They were like, oh, I'm doing okay. I said, are you having issues? And they were like, yep, I can't sleep. Every time I close my eyes, I can see that burning body laying in the grass, right? My first red flag was, why is a person I've never talked to outside of work texting my phone in the middle of the afternoon, right? Now, if you don't think about the PTSD side, you would have been like, they're bored, they want to hang out, they want you to cover their shift, whatever. You blow that off like it's no big deal, right? You have to pick up on little subtle red flags, right? And we're going to talk about stress a little bit here. We get way more into stress when we talk about suicide and mental health issues with the patients. So you guys pretty much nailed all of these, right, except for one. I didn't hear anyone say MCIs, right, which is multiple patients, right, being high stress. So calls involving infants and children, always going to be one of them on our list, right? Severe injuries, that's kind of my joke with the blood in the guts. Abuse and neglect, death of a coworker, all those things are a possibility. So I threw a couple of pictures up here. I used to, when I very first got hired with INHS, I used to travel around and teach to Indian reservations throughout the country. I had to go to Oklahoma, New Mexico, North Dakota, California, Denver, all these places, right? And it was always super fun. 3 or 4 of us from here would get on a plane. We'd get these really, really nice hotels, or they'd be absolute garbage hotels. We get to spend a week or so with, buddies or whatever. And all the agencies that we came in contact with were always like super receiving, right? It was almost like us from Washington walk into a firehouse and they already knew us. Really good buddies, what they want to have dinner, breakfast, whatever. So this middle one right here, so this is in Joplin, is where it's at. And Joplin sits, it's like the corner of Oklahoma and some other state. And what? No, so this, I'm going to tell you here in a second, but it sits right in like 3 different states. So we show up this fire department. It's a pretty small fire department, like 20 or 30 firefighters. And these guys were like, guys and gals, super abrasive. Like, they didn't want to speak to us. They didn't talk to us at breaks. They didn't want to have dinner. They didn't want to invite us out to stuff. And it was kind of like, God, what do we do? We doing something wrong? And so I went to the chief and I said, this just doesn't feel right. I said, these guys seem really, really abrasive. And he said, I'm going to give you a little history of what we've seen in the last 6 months. And I was like, okay. So he pulled these pictures up. So what you're looking at is a semi-truck that's sitting on top of a car. This is car 7 that he's gone through, right? So there was an accident on a highway, traffic is stopped, and this gentleman is not paying attention and is driving at 60 miles an hour and plows through the line of cars, right? The first car he hits is this mangled mess back here, okay? This kills 9 people. So, small town fire department responds to this and has to work through this whole process. Technical rescue, they had cranes to try to get this thing off, this whole process. That's event number 1, right? Event number 2 is they had a car driving on the highway that got in a wreck that launched off the highway down into a river, right? And I think it killed 3. And then a month later was the Joplin F4 tornado, right? Which these guys are first on scene. Tornado comes through Joplin, and it's traveling at about 25 miles an hour. It is the second, or just smaller than the largest tornado possible, right? And it wipes out schools, houses, everything. Those guys are first in on scene of that. So they had 3 MCIs in 6 months, right? And these guys, the chief is like, we have lost firefighters. We have guys that are quitting. They've shut down to each other. They don't talk to each other. They're no longer like participating in activities. And it would just blew our mind of the mental capacity of what these people had seen in just 6 short months. This one, most people probably know, right? 9/11, right? Anybody know what this one? Usually if you're a little bit older, you know what this picture's from. What's that? The Oklahoma City bombing, right? If you know anything about that, what was on floor number 2 of that building? A daycare, right? This is an iconic picture that was used for just about every publication from Oklahoma City. Anybody know what this one's from? This is outside of Sandy Hook, right? What people don't realize about Sandy Hook Elementary, there was a fire department in the parking lot of the elementary school, right? That's how close they were. First on the scene of walking in, there's reports of these guys seeing 5 to 6 to 7, 8, 10 shot children in the bathroom piled together. And they're walking through and pronouncing them dead, right? This one is a staged event, right? This was an active shooter exercise we did, but now with EMS being involved in active shooters, you're going to be involved in some pretty nasty high-stress stuff, right? All the way from high stress to this side of just you're working with law enforcement, therefore it's a little bit sketchy, to somewhat a little more high stress like this. So there's 2 types of stress, right? And we don't really do a really good job of defining them, but you have a positive stress, right? This is what EMS likes. We like that positive form that makes us work well under pressure, okay? And then, of course, there's the other side of stress that's the negative side. Long-term problems, health, well-being. The hard thing is we don't normally pick up on which type we're in. The reason why it's in red is the NREMT loves for you to define one of those 2, right? So it's just a term, get used to it, associate it however you need to, just know which one's positive, which one's negative. That's why it's in red. I don't know if I put it on your next or your first test, but I may have, which is on Thursday next week. 100 questions. Just your little, I was going to tell you on Saturday, but might as well scare you now. Thursday. I don't know how, I have 150 questions, multiple choice, and some labeling. Diagrams or something, I don't know. Short answer, essay, the usual. Kidding. Kind of. The labeling part of it was serious, but the short answer stuff was light. So, signs and symptoms. Everyone's like, oh my God, I'm not listening. The rest of this class, I quit. You can still get 100% of your refund if you leave right now. Signs and symptoms, irritability, inability to concentrate, right? Changes in daily activities, anxiety, indecisiveness, guilt, isolation, loss of interest in work. Okay? So flip from the stress side. Tell me signs and symptoms of someone who you think is depressed or contemplating suicide. Withdrawn. What else? That's a good answer. Too bad I beat you to it. What else? Say again? Lack of appetite, right? I'm going to tell you right now, in EMS, you will be that close to your coworkers, right? You will know if they're excessively eating or not eating as much, right? You'll know if they're no longer showering or if they're showering every 30 seconds, right? You are literally living with your coworkers in most circumstances, right? So what else would you notice? Say again? Negative, right? That burned out mentality or attitude. What else? Say again? Yeah, absolutely. Those are the little red flags you really have to pick up on, because there's a transition. There is, you get off work and you stay drunk until the moment you're not allowed to drink when you're supposed to go on shift, and then you come on shift, right? That will eventually progress to getting closer and close to being on shift, to drinking on shift, which then puts you in danger, right? So there's that progression. What else? Say again, I'm sorry?
Getting things in order, like,
So what do you mean by that?
well, like if somebody commits suicide, they start going to make things right for certain things, getting things.
Yeah, they give away stuff. They start making plans of, hey, in case I'm not here in a year, you know what I mean? They say little things like that. Okay, what else? Anything else? What about a sudden improvement? It's the biggest flag everyone misses.
Where all that and all of a sudden
Yep,
they fire.
they're perfect, right? They come to work, they're happy, you know, they're like, hey, let's go out to dinner or whatever. All of a sudden, they just have this drastic change to totally positive. Believe it or not, that doesn't happen in a flip like that when you're depressed, right? It's a progression. So that's the one red flag everyone misses is you don't want to go to the guy who maybe, 4 or 5 shifts or over a month, he's been kind of down, he's been kind of withdrawn, and now all of a sudden he's good, and you don't want to be like, hey, man, what's going on, right? Because now he's better. You got to pick up on those little red flags. Let's see here. So let's talk a little about stress specifically. So there's an artist that does, it's public service at all, but these are paintings that this guy does for awareness for suicide and stress, right? Most of these pictures, the subtle things you miss is the angel, this one you really can't see, but the angel that shows up in the room, there's one here, there's one on the fire truck here, there's one sitting next to him here. It's the ghost of the patient you've lost, right? A lot of his pictures have that, right? To just show you, kind of drives home the point, right? And like I said, I'm really sad this one cut off, unless it's right. Maybe he's standing right here. Yeah, he's standing right here. There's one here, there's one here, there's one standing next to me here. This one doesn't have one. This one's standing over here, and this one doesn't have one. But it's to drive home that emotional piece, right? In EMS, you are going to see death and dying, right? If you can go your entire career, unless you make your career like a week and not see a dead body, write a book. Whatever you've done, please let me know, right? So up here, there's a list of names. What do you think they have in common? Take a guess. Yeah, how long do you think this has been? What do you think I pulled these names? How long do you think? 2 weeks? More than that. Thank God. More than that. 6 months. These are only EMTs and paramedics. This does not count law enforcement, does not count military. This is just EMTs and paramedics in 6 months.
Are they just EMS employees or are they firemen as well?
That I don't know. Right? I will tell you that the Code Green campaign is a group that is working on like education with this. And so this is in 6 months, and this is only what was reported of the Code Green campaign, which means there could be who knows how many, right? Now, for my short career, right, and I say short because 10 years is not a long EMS career, I went 9 years, and never had like a suicide here locally, nothing, right? It was kind of like we'd talk about it, we'd teach about it, and then we had a guy from AMR a year ago who committed suicide, right? Shows up to the door of his, I think it was his fiance or girlfriend, has an argument, walks outside in her driveway and shoots himself in the head, right? And it was the first time that we were like, wow, like that happens here, right? This is not an uncommon occurrence. This many in 6 months is astronomical, right? I'm going to give you some numbers, even though statistics kind of make me angry, but it drives the point home, right? So there's a survey done. It literally just came out middle of 2015. So they surveyed, it was across the country, and they surveyed EMS workers. It was voluntary. They sent them out to all these states and whatever. So they had a pretty good response. I think they had about 9,000 responses, which is a pretty good population. 85% of those 9,000 EMS workers said they had encountered critical stress in their career, right? So there are that percentage that thought they had, or felt like they had never really encountered critical stress, right? 37% of them had thought about suicide, right? Which is a crazy number. And 6% of them had attempted suicide, right? Now again, you are polling people who are still alive. So that does not count the population that succeeded, right? That's just who had attempted. CDC tells us that only 0.5 of the population in the entire country has ever thought about suicide. And ours in our job is 37%, right? CDC says only 3.7 population of the country has ever, 0.5% ever attempted suicide, 3.7 ever thought about suicide, right? So you compare the job you're getting into with the entire country is pretty crazy, right? So how do we fix it? What do you think? First off, do you think it's a fixable problem? Me too. Right, to a certain extent. So how do we fix it? There's 26 of you, right? So that's my goal. You 26 are going to fix the entire EMS world, right? I have faith. Someone said something about a support system. What'd you say? Okay, so you got to have that support system. Do you think it's a good idea to set up your support system before or after the critical stress? Before, right? Know who you're going to call before it happens.
The other thing I think that needs to change is, like you said, 9-10 years ago you came into this and it was deal with it or get out.
Right.
Well, that mentality is still there.
Absolutely. And we're going to talk about that here in just a second. Keep that thought. What else can you do to fix it? Okay, get better at outlets. What else? Give me one more and we'll move on. Take care of yourself. One more besides that. I like that one. Relax. You try, right? So, what's that?
You gotta make sure you take care of your brothers.
Absolutely.
I think that's the biggest thing in the world is, I mean, you can take care of yourself, but the second most important thing to yourself is the guy that's in the seat next to you.
Absolutely.
The guy that's in the seat in front of you. So,
yeah. It's like that whole, you can catch a fish or teach a man to fish, or I don't know what that's. Someone say it out loud. You know what I'm talking about, right? It makes sense. Moving on. So 66% say they didn't seek help, right? So those people that should have got help, 66% say, I never went. So 75% of those had mental health available to them for free and at zero cost, right? So think of ideas. Why would somebody who's been involved in an incident that needs mental health that's provided to them free at cost, why the hell wouldn't you take it? What do you think? Say again? So there's one, and I've got 3 reasons up here in the percentage that falls along. Ashamed is number 1. Same thing. Pride, is shame, kind of the same thing. Okay, kind of, we're lumping that in with that one. Here's the most. Didn't get help in fear it goes on a record. That you having a problem gets tagged to your name, and if you change jobs, they're going to know you seek mental health. Right? That's sketchy. Right? 23% didn't want to be known as the person who has the problem. Right? You don't want to be the guy on your crew that can't handle a critical call. And then we're concerned what others might think. Right? Now, what do you notice about this? This is all about others. Right? It's all about what people think about you, what people think about you, what people think about you. Right? Number 1 reason is, and just like, remind me of your name. Not you. Not you. You have the same name. What is it? Jake. I know you, Brandon. Shut up. So, that's the idea, is you care more about the guy next to you or the guy in front of you than you care about yourself. You're more concerned what they'll think about you than what it does to you personally, right? So, this is the big one. So what works, what doesn't? Agencies that don't have any encouragement or support, the opposite of what, or like what Adam's talking about, agencies that basically have the buck up or get out attitude, 56% of that group that said, I thought about suicide, are in those agencies. Shocking, right? If you have a supervisor who says, look, here's the deal, you deal with it or leave, the chances of you thinking about suicide, pretty high. A pretty good percentage of those also are the ones that attempted suicide, right? So why, this is the title of an article, why don't more EMS and firefighters have PTSD? Why do you think? 85% have critical stress, right? But we're talking about a pretty small percentage that has these PTSD-like symptoms. So why don't we have more? Okay, so there's the lost soldiers.
Yeah, but there's no way of getting that number.
Okay, so there's a piece of it. What else? What else do you think? Say again?
They don't have the support system.
You're close. You're thinking of the negative side. We're talking about the positive side.
They have their coworkers.
Hey, Nora. Right up there on the podium, if you don't mind. You're right. Right, your first name, John. So John's perfect. With the talk we were talking about showering and eating and sleeping, whatever, with your coworkers, that's why more of us don't have it, right? Because literally after a bad call, the way the system's supposed to work is me and John are on a call, we have a bad call, and I say, hey, how you doing? He says, you know what, I can't sleep. We fix it right now, right? What happens is when you don't have that is when you have the high chance of this stuff happening, right? That's the realism. So how do we fix it? Be closer with your coworkers, right? On your shift, have the ability to be like, hey, Brandon, how you doing? Right? And if he says, I'm doing good, and you know for a fact he's not, you call him out. No, you're not. Talk to me. Right? You got to have that relationship with somebody. Dealing with stress, we talked about. This study that was done also talked about like the ways people dealt with stress. Number one was exercise. Right? Getting out, getting active, whether it was lifting or running or whatever, number one. Right? The other one that I encourage all of you, once you get in this job, because you will find out that this job literally eats your life. Like you turn your life into EMS, right? You wear your uniforms when you're not on duty. You put stickers on your car. You carry your pager where you go. You have a scanner in every room in your house. That way you don't miss a call, including your toilet, right? You live, eat, breathe, sleep EMS, right? That's okay for a little bit of time, okay? And then it burns you out, okay? So take some time away from work, right? Turn your pager off, turn your scanner off, turn your cell phone off, hang up your phone, whatever. Go away, right? Go camping, go hiking, go fishing, whatever. Go off the grid. My friend calls it airplane mode, right? Go airplane mode for a week. Nothing. No one can get a hold of you. Have someone that knows you're supposed to come back on like Friday at 9 o'clock, but no one can get a hold of you, right? That's huge. Don't just go, off in the Alaska wilderness somewhere and end up dead. That's ridiculous. But this is textbook, right? And I wanted to delete this, and I left it because I know there's a test question that talks about it. This is unrealistic, right? I cannot go to my boss at Deer Park and be like, look, man, I had a bad call last week, and I just, you know what, I need to go on a shift or an ambulance that doesn't run cardiac arrest or high-stress calls for the next 6 months. And he'll go, okay, there isn't one, right? AMR. Yeah, here's an application. They're replacing you with a kiosk. So AMR, you can't be like, hey, can I don't like night shift, there's too much blood and guts. Can I go to day shift? And they'll go, no, right? We have a way of doing that. So this is typical textbook. What's the one thing on here you can control? Family time, right? Turn your phone off. The one time that I probably won't respond to your emails in the weird times of the day is if I'm with family, right? If I'm at Deer Park on the ambulance and you guys email me, I'll usually email you right back, right? Because Deer Park is not that important, right? But when it's family time, it's family time. Me, my wife, and my daughter sit down and watch Jeopardy at 7 o'clock almost every day during the weekday, right? My 14-month-old daughter claps and goes ecstatic when she hears the entrance theme of Jeopardy, right? It's the weirdest thing you've ever seen, right? But that's our time, right? I don't like working shifts. I don't like working late on nights that I know I want to be home with my family, right? Make that time when you're in this job. So there's a system. It's called Critical Incident Stress Management. And this idea was brought up in EMS. And we're like, hey, so let's create this system, and this will be for EMS workers that have a hard time with a stressful circumstance. So CISM is Critical Incident Stress Management. CISD is the Critical Incident Stress Debriefing. Management is the idea or the education. Critical Incident Stress Debriefing is the meeting that you go to, right? This is very much a you call it. It's pretty rare that my agency will just put on a critical incident stress debrief, right? Usually what happens is I go on a call and say, hey, we had a bad call last night. We probably should do a critical incident stress debrief. And so they'll notify law enforcement, they'll notify fire, they'll notify all people on the ambulance, and they'll say, hey, Deer Park Ambulance is going to host a critical incident stress debrief. It's at 6 o'clock, and it's on Friday. You're welcome to join if you would like. So the controversial idea of this is it's called a debrief for a reason. We put this meeting about 48 to 72 hours after the incident, right? The intention of this program is for you to go home and you not to sleep and for it to eat away at you for the next 48 hours. So that you come to this meeting with the idea of, I have a problem, right? This doesn't work with PTSD. Because what happens is after the incident, you're fine. So maybe you ditch out on the CSID or you go and you're just like, well, this is stupid, right? And a year later, it bothers you. This only works for that acute stress reaction, right? That's that controversial piece is you're letting them go home and try to sleep when maybe you shouldn't let them, maybe you should engage them immediately. Because critical incident stress management says, we're assuming at the end of the call, your crew has a conversation that says, how you doing? How you doing? Right? It only works if you have that relationship built with your EMS group. The study that was done before that we were just talking about, 97% of those that went to critical incident stress debrief said they were helpful. Right? That's pretty impressive. It's a pretty good program, if you ask me. Let's take a few minutes, stand up, take a break. We've been going for an hour and 20 minutes. Stand up. Half hour longer than I wanted to. All right, so again, the critical incident stress debrief is meant for like a diffusion, right? It's supposed to be diffusing after the process. So, like I said, the downfall was a lot of people kind of thought it was a bad idea. It's available for most of your agencies. If it's not, there's a county-wide critical incident stress team here in Spokane. So if you want a resource like that and you can't find it, you can call me and I'll give you one. You can always come to Deer Park Ambulance. Something along those lines will get you taken care of. So, reactions to death and dying, right? The realization is most people don't see dead people, right? They don't get a chance to see a dead body. In EMS, you're going to see dead bodies, okay? So the first time this happens, it might be kind of a shock or it might be something you're not prepared to deal with. Because of the fact we don't normally see it, it is probably one of the more difficult parts of our job. The downfall is dealing with family is even more difficult than dealing with the dead body, right? You as an EMT, depending on where you go work, may have to encounter the situation where you have to tell somebody their family member is dead, right? I cannot teach you how to do that. It's literally impossible, right? Because there is no tactful, nice, subtle way of doing so, right? Be thankful if you work in a system that has paramedics, because usually it falls on them, right? Most of the time, paramedics are the one having that conversation. Now, depending on the circumstance, you might be telling them this after doing absolutely nothing because that person is so far past that you can't do anything, or like Adam's talking about the circumstance where you literally just threw everything out of your toolbox into that person and now you're all done, right? You can like read articles of things you should say or ways you should do it. I will tell you, to me, there's two sides. One, be as caring as you are comfortable being, right? If you want to get real close to them, if you want to hold their hand, if you want to give them a hug, that's totally up to you, right? The other piece is always be aware that they can react violently, right? That's the piece I'm more concerned about telling you about, okay? You can let your guard down to help them, just don't let it down so far that you don't see the reaction coming, right? Because there's definitely that anger piece that falls along with it. I will tell you, I've seen both sides. I've seen people who are very, very thankful for what you've done. They thank you, they want to hug you, they want to shake your hand or whatever. And I've seen the screaming, yelling, pulling, begging for help, right? The one time in my career I got a gun in my face from was the guy we were doing CPR on his girlfriend, right? And that was his anger reaction, was a shotgun in our face, right? And it was kind of like, well, that changes things a little bit, right? What are you going to do, run? Do you keep doing what you're doing? Right? So it's like that. Now what? Every situation is different. Ours was, my paramedic immediately stood up and was like, we don't know what you're doing, but it's not going to help you, right? We understand you're angry, but you pointing a gun at us is going to do nothing for your girlfriend. If you continue to point a gun, we're leaving, right? We have a code here in Spokane County called Code 99. You get ready to say Code 99? It's like, we need law enforcement right now. We called Code 99, and the dispatcher said, nearest law enforcement 35 minutes from your location. And my partner's response was, we're not going to be here that long, right? Off-duty law enforcement guy came and bailed us out, right? So, you got to pay attention. In that 15 minutes leading up to that, I never would have thought that guy was going to pull a gun. Not at all. So you got to pay attention. You start talking about quitting CPR or terminating efforts or not transporting them because they're too far gone, people get angry, right? You really, really got to pay attention to that stuff. So what do you think EMTs know about death and dying that non-responders don't? What do you think? What do you think we see with death and dying non-responders don't?
Not like the movies.
Jordan, not like the movies. How do you mean?
Like, you can't just do CPR. Everyone's going to come back from CPR.
How many of you think that, anyway? How many of you watch Chicago Fire?
You know,
I knew it when I was a kid.
My chiseled jawline, you know, I got shirt off my washboard app.
Just describe District 10, right? That's no big deal. What else? What else do you think we know about dying that people don't? Go ahead.
People's reactions.
How do you mean?
Bystanders, like if family watched or immediate responses.
Okay. What? It's not pretty, right? The shows never, unless it's a trauma in the show, they never show the vomit, the urine, the feces, all the stuff that happens in real life, right? TV, you can't smell the smells that are associated with cardiac arrest, right? Yeah, they also never show what a real cardiac arrest looks like. They're showing you the 5% of the perfectly well orchestrated. Great communication, great teamwork, and I've been in those cardiac arrests and they're amazing. I've also been in the cardiac arrest that looks like there's a term that has to do with a species of animals and footballs, right? You know what the term I'm thinking of? If you don't, someone tell the person next to you.
Charlie Foxtrot.
Yeah, absolute giant disaster, right? People are pulling stuff out, they're yelling, they're fighting, and you're like, are we being serious right now? They're pissed off at each other. Families in the way, like everything's going wrong, right? Our house explosion, we got the guy out of the house, we started an IV. I tried 3 times to get an IV. This guy literally burned almost 100% of his body. Finally get an IV, and I was like, perfect. Firefighter walks by and kicks the line out of this guy's arm. And I've never in my life wanted to stab somebody, right? I was like, you mother, you don't even know how hard I worked for that, right? That's what really happens. That's real life. What else do you think that we know that they don't? Anything else?
The beautiful last word, the last poetic word.
Oh, you're saying they don't have those? Oh, okay, because you've worded that really weird. Yeah. So there was an article that came out that was talking about that of EMS makes you realize that your life can end at any point, right? From 0 years of age to 100 and whatever years of age, whenever, right? And that was probably, the article was like, that's probably what bothers EMTs the most, And what usually puts the fear of dying into you is it literally can happen doing the oddest things, right? Things you wouldn't even worry about. There was a nurse in, I think it was Detroit, who walked outside of a hospital, and I kid you not, a gargoyle statue fell off the hospital and killed her. Right? You're like, when it's your time to go, it's your time to go. Like you would, yeah, hope with hope, right? At least she was in the hospital. Probably didn't have any better chance of surviving.
Ran on a lady that died. Like, I guess it's more common than not, ran on a lady that died on the toilet, you know? She was
Yeah, that happens all the time. It's like every week in Deer Park. So here's the emotional stages of dying, or emotional stages of, sorry. You should know this progression. Denial, anger, bargaining, depression, acceptance, right? Doesn't necessarily go in this order. Sometimes they skip and go right to the anger phase, right? Sometimes you get there and they're at the acceptance phase, okay? So these are the stages that they work through. Not me, why me, okay, but first let me, okay, but I haven't, okay, I'm not afraid. This one's kind of a scary one, right? Especially if you're the injured one. There's a lot of research being done that when you tell yourself, okay, I'm ready to die, a lot of things just go downhill, right? Your adrenaline goes away, you stop trying, you stop thinking you have only one option, all that stuff just changes, right? So when patients get to that point, sometimes they just go drastically downhill, right? So again, recognize the patient's needs and then look at the family. Okay, listen to them, try to explain them what's going to happen. So this says, do not falsely reassure. What do you think is the one thing that you never tell a patient or their family? Everything's going to be okay. Don't worry, everything's going to be okay. Right? What's the one thing that every patient and family wants to hear from you as a trained medical professional? Everything's going to be okay. And they will bait you, right? They'll be like, are they going to be okay? And you're like, in the best hands possible. We're going to get them to the hospital, and they're going to be seen by a doctor. I understand that, but are they going to live? They're in the best hands possible. We're going to do everything we possibly can. And they're like, right, I understand that, but just tell me they're going to be okay. What's that? Yeah, we just make the comment of being like, feel like I'm going to die. You're not going to die, nah, you don't know that, right? Them telling you that impending doom is actually a huge red flag for a bad medical problem, right? Them being like, I feel like I'm going to die. You probably should listen to them. And I'm not talking about the 14-year-old that just broke up with her boyfriend who thinks she's going to die. I'm talking about a real medical condition, right? That's a huge, huge red flag. Offer as much support as you can. There's all kinds of stories of, firefighters coming back and shoveling sidewalks or locking up someone's house. I almost always say, is there someone you would like to call, right? Is there someone that can be here with you that's not me? I don't mean that a bad thing, but I know you don't want me to comfort you with your problems. You don't know me, right? Who would you like me to call? Your neighbor, your friend, a sibling, who? Right? Stay there until this process is taken care of. Okay. So, scene safety, right? What is the only safe scene? Say again? You gave up? Okay. What's the only safe scene you think? What? The scene that you're not at. Right? When you're no longer alive. Yeah. The only safe scene is the one that you are away from. Right? The scene safety never stops from the time you get in your rig to go to a call to the time you get back. Right? It changes at multiple different times. So, we used to teach this unrealistic piece of it, right? When I took my EMT class, scene safety was the words that you said when you started a scenario. BSI scene safe, and you just started doing what you're doing, right? In this class, what I expect you to say is my scene safe? It's not a statement. We want it to be a question, right? And I might say, yeah, the scene's safe. Does that mean it's safe? Nope, right? You will be in circumstances where law enforcement's been there before you, and they say, yeah, the patient's good, and guess what? You find a weapon, right? A video just came out a couple weeks ago, but I've got one that I'll show a little bit later in class. that is, the one that just came out was the guy that gets brought into the precinct. Have you guys seen this? The guards bring him in, and he's standing against a wall, and he turns around. There's like 6 or 7 jail guards. And the guy says something, and the guard walks over, and he pulls a gun out of his waistband and gives her the gun. Right? He had been searched 3 times by law enforcement. He had a handgun in his pants. Right? The video I have is, if you haven't seen this one, is a guy who had murdered a police officer, who is in jail, and they put him in a questioning room, and the detective leaves, and he pulls a gun out of his pants and shoots himself in the head and kills himself. Right? He'd murdered a police officer, been searched God knows how many times, and he had a handgun in his pants. Right? That's just because law enforcement's there does not mean that you're safe. It means you can go in. It doesn't mean you can put blinders on and forget about all the stuff that we're going to talk about. Yeah. And they might not have a gun, but they might have something that can hurt you. Yeah. So approach and position, right? So this is the house that you're responding to. Now, the realism of law enforcement being on every single one of your calls, get it out of your head. It's never going to happen. Right? Now, the caller says there's a gun or there's a knife or whatever, okay, they might send law enforcement. If I have chest pain, no cops. Right? Most medical calls, you get no law enforcement unless they're bored and they just drive by. Right? So, walking up to this house, what are some of the dangers that you would encounter, and what are some of the things you want to pay attention for? If this is somebody's house, I'm really sorry. I literally Googled messy house, so if this is yours, I apologize. You had really bad luck.
They look like they're hoarders.
That seems a little, like, aggressive. I mean, I didn't tell you it's actually my house, but thank you. No, just kidding. So what do you think? Approaching this house, how are you going to approach it? Say again? Okay, so pets, right? Everyone always thinks about like the guns and the knives. No. Like chihuahuas, dogs, parrots, weird stuff, right? So someone said about an angle. Who said something about angles? Vince like, wasn't me, it was her. Okay, so what are your routes of escape? What'd you say, Vince? Sorry? So if you have the lead, you're going to go out those, right? So what about walking up? So let's say this is the front door, right? Would you check this window before you walked up to the door? I would. Right? When you go up and knock on this door, I would probably encourage you to stand off to the side of the door. Right? EMS used to be really, really good about standing at the front of the door and be like, hey, 911's here. Right? And that's great as long as I don't want to hurt you. Okay? Stand off to the side of the door. Knock on the door from the side. When you enter this, start paying attention, right? Open doors, stairwells. Now, Michaela has a good point. If you had to get here in a hurry, there's a lot of obstacles that you probably have to come over, right? What about walking up and with the foot, like inappropriately or mean, just brushing that stuff to the side, right? Give yourself, because to me, if you're going to bail out of here, you're either going to bail off this, or if there's an exit, you're going to go off the one side of that, right? Make sure you have a path of escape when stuff goes wrong. Okay? In EMS, you should be really good at plan A, really good at plan B, C, D, and F. Right? You should have a backup plan for everything that goes wrong. Plan F is usually the end. Right? So in this case, stand off the side of the door, check your window, right? Knock, announce your presence, that kind of stuff. So you walk up to a house, and the door's open. Now, if you notice, I did something on purpose. What do you notice about the two houses? So you're right, the judgmental view of these two houses. Yeah. So the funny thing is, I know that's in refresher class, and I hid this picture. Every single one of the practicing EMTs said they would walk into this house and open the door and be like, EMS is here. And then I showed them this one. They were like, not at all. I said, why the hell not? Is it the same house? Can you get shot in this house? Can you get shot in that house? Could this be a drunk, belligerent asshole? Can there one be one in this house? Absolutely. There's no difference. Right? Now, you've been assaulted before. You've never been here. Maybe. Right? I'm still going to stand at the side of the doors. I'm going to open the door. I'm going to holler out. Right? 911, EMS. If someone says, you You were dispatched to a 95-year-old lady who fell, and she hollers out, enter the house. You were dispatched to a 45-year-old male with chest pain. I gotta have something more before I walk in the house. Or I go, hey, Anthony, let me know if you need anything. Go ahead. Right, I'll stay out here. You go ahead. Right? Call law enforcement if you get that weird feeling. Okay? So, does this look right? What do you think? I agree. Any weird red flags? Yeah. People don't realize this. Like, time out. Someone lives here, but you got a weird lock on the door like it's a house for
The
sale.
lock's been pulled, the deadbolt's been pulled.
There's no deadbolt.
But the lock's on the outside.
Weird. It's a lockbox for a key, right? So it's like subtle things that we don't pick up on. Take a second, take a deep breath, and look at your scene before you just walk in this door. Okay? So this is meant for real life. This isn't meant for your textbook. Okay? Number one, EMS may be dangerous. Shocking. Remaining safe involves a series of important decisions that you're going to make under pressure. You can pre-plan it. It'll never go the way you plan. Okay? There are many times you should drop back and wait for help. There may be times where you choose to take a calculated risk. What are those circumstances, you think? Can you think of a time that you would jeopardize your own safety to enter a scene? Frankie?
Well, which is that story you told about the boy in the pool.
Okay. I like that one. Give me another one. Say again?
Car fire.
Car fire. I like that one. So let's say you get dispatched to a chest pain at elementary school. And you show up and you hear gunshots. So you back out, right? Call for law enforcement. Law enforcement shows up, goes inside. You hear more gunshots. Law enforcement comes back out and says, we don't know where the shooter is, but there is 15 dead kids and there's more injured. I want you to come help me. Are you in a safe scene? Are you going to go? Your choice. Right? Are you going to get fired for going in there? Probably. Right? That's that calculated risk. Okay? Most of us are in this job to help somebody. There are safety precautions that can be used to reduce the risk, right? And you will never be able to help, and you may become part of the problem if you are hurt or killed. Okay? That's the stay out unless it's one of those things you're going to choose. If not, if you add to the problem, you make it worse. Okay? So you're driving home from a shift when you see fire trucks off the road, or you see tire tracks off the road into a lake. Two bystanders are waving frantically. A minivan has gone into the lake with multiple occupants. The van is not visible. List 5 considerations that would be important to help you decide whether or not to attempt a rescue of the occupants. How deep is the lake, Frankie?
What time of year?
What time of year? So what are you looking for?
Like, if you're going to get hypothermia.
Okay, so you're looking for the water conditions, right? So water conditions, how deep is it?
Where's your nearest tech rescue team?
Okay.
I mean, because if it's like right off the Maple Street Bridge, ladder 4 is like 30 feet
Okay.
from where you're at.
So what do you have for resources? What else?
I think, like, looking at that,
How do you mean, Vince?
like, oh, that man is one.
How long is the bubbles?
Okay, I like that. So how long is the van in the water?
Bubbles coming out.
Is there bubbles? Okay, what else?
Is it actually going to be worth trying to put time in? Are they going to be favorable?
Okay. So does anybody know where the story comes from? It happened, I think it was in Las Vegas, right? There's pictures of the 2 fire crews standing on the embankment staring at this minivan in the water. And their policy was to not get in the water, and so they stood there. Right? And the pictures were all over everything. Social media, news sites, how worthless firefighters are, why would you not risk your life, that's your job, all that stuff. Right? The chief came out and was like, they did exactly what they were supposed to do. The public doesn't care. Right? That's the damned if you do, damned if you don't.
How long ago was that?
Not very long. Within a year and a half.
Is that the one where the civilians rescued them?
I don't think so. Fire showed up and pulled them out. Go ahead, sir.
So you said that they go through and like look at the policy and the paperwork and say, if people die because of our policy and all
Right.
that, then they change it. Why don't they change that? Is it statistically safer?
It's a safety issue. Right, and I will tell you, like, so my thought process, let's say there's a van at Loon Lake, right? Probably going to get in the water. A van in the Spokane River, not a chance in hell. Right? A van in the frozen Loon Lake or a van in the middle of July in Loon Lake, totally different. So the protocols are trying to encompass everything. Ice water and swift water, I don't care who's in it, you stay out of it, right? It will eat you and kill you, right? How many times have we seen people die in the Spokane River every single year, right? Some summer drowns or, underestimates how much current there is or whatever. Ice water is the same stuff. So really, protocols are meant to encompass a one-size-fit-all. EMS isn't a one-size-fit-all. It changes on every single call.
The other thing you have to think about when it comes to what you're saying about water and encompassing. Just a question. Do you guys get hypothermia in the summer?
The water temperature, like Roosevelt, perfect example.
Priest Lake is the other one.
They're, what, 40, 42 degrees?
Yeah, 50s and 60s maybe in the summertime.
In the summer, in the middle of July, in the hottest part of our year.
Yep.
So you have to think about that, too. I mean, what's the time of year? Yeah, great, but are we in the summer? What lake am I in? I'm in Lake Roosevelt. Do I have the necessities to survive my plan?
Then I'll go think about how many of you are swam in jeans and boots and a sweatshirt.
Well, like my Knicks I have Knicks boots, my wildland boots, they weigh 16 pounds.
Right. You're getting the water with those.
Yeah, and like I'm going to weigh, 275 soaking wet.
Right. And people are like, well, I would just take off my uniform. Yeah, okay. Right? That's unrealistic. You're not going to strip down and jump in to save someone's life in your underwear. You're going to get in your uniform. Wow.
Take off your chiseled jawline. Dry his clothes and walk away.
Man, you and this chiseled jawline, he is so mean to you. I'm recording this. I have to edit all of this stuff out to show my online EMT students. You are staged in the scene of a school shooting. Come up and talk about. Police command wants 2 EMTs to enter a warm zone with tactical officers to rapidly treat and evacuate casualties. You have a helmet and body armor. Poof, right there. While inside, near a child who is bleeding, you hear shots, and the officer advises you that the shooter is on the move. So 3 tactical options you have at this point. What do you think? There's hide. You have a gun. You have a helmet and a vest. There's no shooting back. So there's hide. What else?
Get out. Eat
There's get out. Right? Leave the kid. Don't look at me like that. You got to answer the question. Taking the kid with you or not. Depends on what.
How fast they are. If they're like real close to
He's bleeding.